One procedure a lot of patients are really curious about now is something called a buccal lipectomy. Some people call it buccal, you can call it buccal, tomato, however you want. It's spelled B-U-C-C-A-L, but what it's talking about is a buccal fat pad in your cheek. And why it's very popular is a lot of patients that feel their face is bottom heavy or that they have a rounder face and they want that contoured kind of chiseled look. Removing that fat pad achieves that look. And one thing I like to tell my patients is if they want to get an idea of what they might look like after a buccal lipectomy is to suck in their cheek a little bit without looking like a fish. So kind of suck in a little bit. And if you like that contoured look, that's what a buccal lipectomy will do for you. Now this is a very simple procedure. It's one little baby incision inside your mouth by the upper molar, and it's one dissolvable stitch. We take out that fat pad, that's it. It's not painful, and it's a very quick recovery. Because it's almost painless and there's no bruising, even the next day, it's even probably a little bit less than going to the dentist. You shouldn't have much bruising, you should be able to see friends, do things normally, you'll be eating normally. This is not a procedure that's gonna knock you down for a long time. So whenever I'm doing a buccal lipectomy, I'm also looking at the other facial features for something called facial reshaping. In other words, people coming in with a bottom heavy face often want to do other things with that procedure to create even more of a heart-shaped face. And the way that we do that is once we take in that buccal fat pad, we can also add to the cheeks to give more of the upper part of the heart. And we can also subtract from the lower part of the face. We can do liposuction in the neck area and contour the entire jawline. And with that, when I'm taking in the lower face with the buccal lipectomy, or bringing in that cheek, we can also do other things to augment the upper face to make it look more heart-shaped. And the reason we're doing that is something that's timeless throughout all of beauty called an OG curve. That's O-G-E-E. And what that is a smooth S shape to your face. We see it in all of nature and architecture. And the reason we're doing that is to the eye, we're thinking about making things more beautiful and getting that OG curve. So what can we do to make that even more heart-shaped? So adding fat to the upper face or subtracting from the lower face. So we can do submental liposuction to clean out the neck or a double chin. We can also contour the jawline, or we can add fat to the upper face to again flip that face from a bottom heavy face to a more heart-shaped face. One thing that I love about the facial reshaping procedures, which include the buccal, the fat grafting, and the liposuction of the neck, is that they're all scarless. There isn't any incisions, there's nothing to hide. People can look at you and try and figure out what's going on. But because they're all hidden either inside the mouth or one dissolvable stitch somewhere, nobody's gonna know your secret because it's all scarless. Secondly, it's not painful. These surgeries are not painful surgeries, they're not long recoveries. So overall, they're really fun procedures to do because patients get what they want out of the procedure with not a lot of downtime and not a lot of recovery. If you have more questions about buccal lipectomy or facial reshaping, please leave your questions in the comments below.